As of the 2016 census, approximately 142,000 Australians were identified with Maori ancestry, making up approximately 0.6% of the population. Unfortunately, Pacific Islander studies have been in decline within Australia for several decades and thus pose a significant problem for understanding and maintaining their health and well-being. Due to New Zealand holding the largest Maori population in the world, they have the best available evidence and statistics, thus should be used to better inform the Australian health sector. Two issues that are disproportionately affecting the Maori population include obesity and diabetes. Excessive body weight has been heavily associated with the formation of type 2 diabetes, with approximately two-thirds of Maori children, aged 5 to 14 in New Zealand, being deemed overweight. It's not surprising that alongside with Pacific Islanders, they have the highest rates of diabetes in the world. As type 2 diabetes is a mostly preventable disease, it's likely multiple factors are influencing the health outcomes of the Maori population, such as lower socioeconomic status, cultural eating practices, health education, and health access. As diabetes is largely brought on by poor diet and a lack of physical activity, which are characteristics of the obesity, focusing on ways to reduce obesity amongst the Maori population will likely resolve both health outcomes.
Specific historical, political, and social circumstances are critical in understanding the health needs of any Indigenous population. Across New Zealand, there are clear disparities in health outcomes between Maoris and non-Maoris due to circumstances such as socioeconomic status, lifestyle choices, health education, and health access that are also prevalent within Australian society. The key to improving the population's overall well-being is to first consider how these factors are influencing their health. In the 1950s, there was a large influx in Maori immigration to Australia, mainly due to job availability and better paid employment. Mostly sedentary, entry-level jobs, such as clerical, administrative, and machine operation jobs, were quickly filled, as qualifications gained in their home countries were not granted upon immigration. It is well studied that a prolonged sedentary lifestyle results in weight gain and can lead to serious metabolic disorders, such as diabetes. In recent years, Queensland has become the home for a significant percentage of Maoris, most notably occupying blue-collar jobs. Due to the economic restraints placed on these households, medical visits can become too expensive and too time-consuming, leading to delayed medical treatment. One survey found that Maoris were twice as likely to go without healthcare in the past year due to its exorbitant cost. Unfortunately, as preventable healthcare issues such as diabetes progress within the body, the ability for meaningful intervention quickly diminishes, resulting in significantly poorer health outcomes, and is likely the reason why Maoris are more likely to die from diabetes than non-Maoris. Furthermore, in New Zealand, the most deprived areas are home to over half the Maori population. This disproportionality is likely responsible for the inequities within the healthcare system, as high levels of socioeconomic deprivation are linked with poor health-related quality of life.
Pacific Islanders, specifically Maori adolescents, may have an array of experiences whilst using health services. As Matthew mentioned, this could include access to services, culturally inappropriate health services, socioeconomic status, and a lack of knowledge. These all provide some of many barriers experienced whilst accessing health services. Cost is an underlying issue raised as a factor influencing young people's choices to seek advice and health services. For example, the cost associated with paying for appointments and lack of resources to buy appropriate food, all contribute to experience while using health services. The lack of access for Maori teenagers may experience limited access to health services and can be caused by unemployment, geographic location, and education. Maori teenagers can seek a lack of access to health services due to lack of reliable and affordable transport. Also, not having their own Medicare card can influence their access to health services. Furthermore, Pacific Islanders, specifically Maori teenagers, experience a limited range of services which are not community-based, acting as a barrier accessing health services. The Queensland Health stated that there was a lack of dedicated Pacific Islander programs, health workers, and services which contributed to the lack of access to health services. The lack of knowledge for Maori teenagers impacts them when using health services, indicated by the low levels of education and literacy measured amongst Maori teenagers surrounding diabetes, knowledge, and public awareness. Maori adolescents often feel neglected and misunderstood because of poor communication from health workers. Health workers should avoid using medical terms and ensure their patients understand, as this can be a huge barrier for Maori adolescents. Having information brochures in different languages and other resources would help with patient-worker communication. Fear may be experienced by Maori teenagers when using health services and may lead to mistrust. Maori adolescents generate fear and uncertainty when accessing health services, including fear of judgment, stigma, results, and concerns that their information won't remain confidential. This can be caused by past experiences of the health environment, such as discrimination towards the teenagers. Maori teenagers may be hesitant to access health services as they may hold a spiritual health beliefs and the system is unfamiliar to them. These barriers that Maori teenagers experience leave them feeling disempowered, uneducated, and lead to a lack of confidence in obtaining information to.
Although there are slight differences when comparing the Maori and Wiradjuri health experiences, the similarities are striking. These include their experience within the healthcare system, with diabetes, and with other relating factors. But to really understand the health experiences of the Maori and Wiradjuri people, we should look historically to the past of both populations. Both the Maori and Wiradjuri people faced similar pasts. For example, when Europeans first arrived in New Zealand, the Maori had no immunity against any diseases they brought with them, and with the rapid loss of their land, many tribes struggled to survive. Similar to colonisation in Australia, where the European settlers came and stole land from the indigenous people. Colonisation had detrimental effects on both populations, and as the non-Maori population grew in New Zealand, their institutions such as hospitals slowly became Pakeha, meaning white, dominated, leading to increase in suspicion and distrust between healthcare workers and the indigenous people. As the Maori population migrated to Australia from New Zealand, they carried their cultural suspicions towards these white-dominated institutions. Through colonisation came changes in lifestyle, with new foods and ways of living being introduced. However, this change was not for the better and can be known as the coco-colonisation. The replacement of traditional diets by poor quality, high processed foods led to poorer health outcomes amongst both communities. Another similarity these populations share is their care and responsibility for family. It is so strong that they will put another family member's health and safety first before their own. In one article, they stated that it was considered a cultural expectation to provide family with food, accommodation, or money, regardless of one's own circumstances. This can negatively impact individuals both psychologically and physically, and is evident in the coping behaviors of both the Maori and Wiradjuri populations, as many of the people turn to smoking, drug use, and alcohol consumption. As previously stated, a difference that can be seen between the Maori and Wiradjuri people in Australia is that one is a migrated population. Maori people were originally travellers from a group of islands in Polynesia in the South Pacific Ocean, who became the first inhabitants of New Zealand and later migrated to Australia. Australian migrants undergo rigorous health checks, and upon arrival, their statuses are almost always better than those who are Australian born. However, the longer the time they spend in Australia, the closer their health replicates that of the Australian born population, meaning their healthy status is slowly diminishing.
To improve healthcare delivery and outcomes for cold patients, health professionals should provide patient-centered care utilizing respect, empathy, and sensitivity while understanding the patient's differences and values. Understanding and developing cultural competence through a combination of behaviors, attitudes, and policies will enable clinicians to work effectively in cross-cultural scenarios. As an OT, it is important to understand the importance of building a relationship with Maori adolescents to meet their needs. Creating this bond demonstrates strong positive interaction and communication between each other. An OT should display great interpersonal skills such as strong verbal and nonverbal communication and active listening in order to support Maori teenagers with engagement in occupations and other daily activities. This will also require the OT to demonstrate patience and determination to promote the patient's autonomy and initiate health-promoting habits and routines to manage diabetes. The role of an exercise scientist is to design, implement, and evaluate exercise and physical activity plans to prevent chronic illness, in this case, diabetes. For this to be successful, it is crucial to provide patient-centered interventions by working with the client to create an individual plan with personalized goals. Encouraging empathy and understanding, and by working with the client, sports scientists can enter the patient's world to see the illness through the patient's eyes, taking into account their life experiences, culture, beliefs, and identity. Focusing on patient-centered care allows for more patient intervention and involvement by making decisions for themselves rather than relying on health professionals for these decisions. To address type 2 diabetes, clinical nutritionists must provide nutritional care and treatment. The very nature of the disease, that being it stems largely from lifestyle choices, means that a collaborative, patient-centered approach would achieve more favorable health outcomes. As such, a bifold approach must be observed. This approach must incorporate qualitative data analysis an interpretation of the current dietary intake of Maori adolescents in conjunction with partnership with these adolescents alongside their parents and guardians. Through analysis and interpretation of the client's dietary intake, tailored diet plans can be created. The key to this approach lies in effective communication. Hence, to ensure health outcomes are met, clinical scientists must effectively communicate with their clients to improve health education through tailored diet plans and counseling sessions. Paramedics provide emergency healthcare to patients in their worst moments. Being healthcare professionals who enter people's homes, it is of utmost importance to be culturally competent and to adjust treatment options based on their own beliefs. Recognizing the needs of the Maori community, it is important to understand the risks of developing common diseases such as type 2 diabetes and promoting health services that can benefit them whilst being sensitive to their cultural and spiritual beliefs.
It has been well studied that children and adolescents' habits are moulded by their parents' own habits. A study found parents with healthy weight were 3.7 times more likely to have a child within a healthy weight range as compared to those parents who were overweight. By developing a strategy that targets parents and leaders within Maori communities, it will likely reduce the incidence of diabetes and obesity levels within Maori children and adolescents. To facilitate this knowledge transfer, an outreach program will be set up where professionals such as clinical scientists, sport and exercise scientists, and occupational therapists engage with parents and trusted Maori leadership in each community and provide key information regarding diet, physical activity, and lifestyle changes and how to easily access these options. Contact information would also be provided so that individuals in the community who wish to speak one-on-one with a professional can do so. The main goal of the outreach program is to reduce the mortality rate diabetes has on the Maori community by targeting adolescents who may be in the early stages of this reversible disease. Forming a diet plan has always been an extremely personal experience, and it doesn't always fit a one-size-fits-all model. By providing the community with access to clinical scientists, diets can be workshopped and tailored to suit the needs of specific individuals based on their lifestyles, preferences, and cultures. The main elements surrounding the diet plan will be to lower calorie and glucose intake, preventing diabetes from progressing. Understanding this, it is important to manage what is being consumed by Maori adolescents. A study found that the median intake of sweet drinks by Maori adolescents was approximately twice the average intake. Included in these drinks are nutritive sweeteners which provide what is known as empty calories and lead to excessive weight gain. By substituting these with drinks containing non-nutritive sweeteners, it will still provide the same sweet flavour. It will not raise glucose or insulin levels within the blood. It has been well documented that increased physical activity is essential in combating type 2 diabetes. It is so prevalent that exercise is the first recommendation made to manage new diagnoses of diabetes. However, by developing these habits early in young Maori adolescents' life, prevention can be prioritised over treatment. By having a sport and exercise scientist inform parents and Maori leadership of the importance of moderate to high intensity aerobic exercise, such as running or cycling, it would allow families to instill healthy training habits within the teenage children with the intention of preventing serious health concerns such as diabetes. Performing approximately 150 minutes of moderate to vigorous exercise per week has been shown to promote weight loss and maximize insulin action, counteracting the main mechanisms of type 2 diabetes. The main issue with this outreach program is ensuring that the information provided is not only successfully adopted, but formed into a habit amongst the population. By providing access to occupational therapists, following these information sessions on diet and physical training, discussions on the formation of new, healthier habits, and the breaking of old, unhealthy habits can be communicated effectively to the community. Habits are often seen as automatic and can occur in the absence of mental effort or awareness and tend to persist even after a shift in motivation. By establishing a consistent model that incorporates activities such as aerobic exercise and eating healthy into Maori teenagers' pre-existing lifestyles, they can maintain their fitness and reduce the risk of type 2 diabetes as they age. In order to develop such a strategy, occupational therapists would identify the needs of each individual through a one-on-one consultation, exploring the spiritual, cultural, physical, and environmental factors that underpin their current situation. Allowing these factors to continue playing a prominent role within their lives will promote a healthier relationship with these new interventions and likely lead to them becoming habitual. Creating awareness for this outreach program is now a key concern to be addressed. As Maoris have been seen to be twice as likely to go without treatment compared to non-Maoris, it is critical that when they do seek help, information about these programs is provided to them. Within Australia, paramedic scope of practice is rapidly increasing, and health promotion is engaged in daily, making them the perfect candidates to provide referrals to outreach programs such as this. Allowing paramedics to promote such health services to a broad range of Maoris will help spread the awareness for the program throughout the community.